All right, so it's my pleasure to have Dr. Ashley Whiteside come speak today. She is a veterinarian, excuse me. She'll tell you all about her career, but apparently, and I kind of remembered, she minored in zoology. So I think that's really cool. So she's an alumni from Western Illinois University, and she's teaching 2 classes with the agricultural department. And I want you to hear about that because I think those are some pretty cool classes. Like I said, we will make sure that you can get biology credit towards either your zoology or your medical sciences option if you decide to take that class. I think you'll find it beneficial. So let me get out of your way and let you go ahead and get started.
I just pull this up here and it'll automatically share.
Yeah, let me hit the share the screen. And then everybody can see that on home, looks like, so.
Okay. Yep, like he said, I'm Ashley Whiteside. I'm a veterinarian. I graduated from Western in 2015 and then went on and did my vet school degree over at Iowa State in Ames. Finished that in 2019, and then I came back to this area, I think in 2020, 21 maybe. And Dr. Baker, who is in charge of the Ag and Animal Science department, reached out to me and asked me if I'd be willing to kind of just like mentor pre-veterinary students, talk to them about classes, things like that, which kind of morphed into having an adjunct position with the ag department. So now I teach 2 classes down there. So I kind of split my time between being a practicing veterinarian and a professor. So that has been a learning curve, but it's been fun. So I have a short PowerPoint here and then we'll do some questions. So while I was at Western, so I'm actually local. I graduated high school from Macomb here. And then I came to Western and did a major in agricultural science. And then I minored in chemistry, zoology, and animal science, just to kind of cover my bases. If I didn't get into veterinary school, my plan was to get a master's and a PhD. So I wanted to be well-rounded and prepared for that. But I was able to get into vet school on my first try, which was very lucky. I got into Iowa State, started there in the fall of 2015, graduated in the spring of 2019. So while I was at Iowa State, they'd have a program where it's called tracking, which is where you choose whether you want to do like small animal, large animal, mixed, exotics, things like that. So I tracked large animal equine. I kind of grew up in a very rural setting, worked at a local practice that did a lot of large animal work. And so that was what I had been exposed to and had experience with and really enjoy. So here's a lovely picture of me. If you have any questions about what vet med might look like on a day-to-day basis, this is an excellent example. This was after I put a uterine prolapse back into a cow. So what that means is she had a calf, she'd had a baby, and then didn't quite stop straining in time, and she spit her uterus back out the back end, which is an emergency. So we have to go put those back in, and it's a pretty messy situation. But this is a picture that one of my lovely technicians took, and we used it for our clinic Facebook page for a while, but it actually is a great depiction of what being a large animal veterinarian looks like, because it's always pretty messy. So, like I said, I split my time now between teaching here at Western and mentoring pre-vet kids, and then practicing locally. So as far as what is a veterinarian, if you've never been to a veterinary clinic or had a pet that needed to seek veterinary care, then you might not be familiar with it, but really short answer is we're animal doctors. So we're equivalent to human doctors or MDs. Long answer being most veterinarians play a lot of different parts in a single given day or a single appointment. While we are in veterinary school, we touch base on internal medicine, anesthesia, ophthalmology, dermatology, diagnostics. We learn emergency procedures and responding protocols. We learn reproductive medicine, which in veterinary medicine, that's called theriogenology. We learn how to be teachers, neurologists, epidemiologists, dentists, orthopedic surgeons, radiology. We are very diverse in what we learn when we're in veterinary school, and we're also very diverse on what we do on a day-to-day basis. So if I see a patient in a clinical setting, I start with a physical exam, ask a bunch of questions, talk to the pet owner, talk to the cattle producer, the equine owner, whatever, and then develop a diagnostic plan from there, run diagnostics, run x-rays, run blood work, whatever is necessary, take those results, interpret them, and develop a treatment plan. So at any given point for any patient throughout the day, you can be dealing with skin to eyeballs, to the bladder, to blood work, to x-rays. It's very diverse, and it's absolutely never the same thing on a day-to-day basis, let alone an appointment basis. So if you thrive in chaos or having things not be routine, then being a veterinarian might be for you. So how did I get to where I am today? If you are interested in vet med, we can absolutely talk outside of this course more, but basically I spent my undergraduate years here. I got an education. I listed my major and my minors, but I took all of the prerequisite courses that are required by veterinary schools, and then took pre-entry exams, which at the time was the GRE, but I believe most schools have done away with that now and do what's called the Casper test. If you guys have heard of that, I think it's a personality interpretation thing. I got a lot of experience. I worked at a veterinary clinic from the time I turned 15 until the time I went to vet school. So I worked there, I think like maybe 10 years before I ended up applying. Got a lot of experience handling animals, working with them in a veterinary setting. Did a little bit of research through the ag department, nothing like official, but I helped with the bull test that they do every year and managed some data with one of the professors that was here at the time. And then as far as professional experience, I joined organizations, networked with veterinarians, networked with veterinary students, built relationships with professors, things like that. Applied to vet school, got into vet school, went through the application process and the interview process, ended up at Iowa State. Every veterinary school's curriculum is, I don't want to say it's the same because it's not. Every school has their strength and weakness, but they have a core curriculum that they have to follow, that everyone has to take in order to graduate to be a veterinarian. On top of that, I took quite a few electives geared towards large animal stuff. And then when you get to your 4th year of vet school, you're in the hospital on clinics doing hands-on things, and you take your boards at that time. And so we had to pass boards in order to get our veterinary license and graduate. And then while I was in vet school, not much changed as far as experience. I continued to work on animal handling, did a little bit of research, built relationships with professors and other veterinarians, networked, and worked in veterinary clinics as much as I possibly could while I was in school. You cannot overdo your experience, especially if you are applying to a professional program or seeking some sort of professional training after your undergraduate degree. So any sort of like in-person hands-on experience you can get, I would advocate for. So as far as getting started, if there is anybody today that's interested in vet med, the first thing I would say first and foremost is find a veterinarian and bug them day in and day out to hang out with them. Most veterinarians are pretty open to students. At one point we were all the student that was needing shadow experience, and so we understand. We as a profession try to really foster the next generation. So if you guys are interested, don't hesitate to reach out to your local veterinarian at home, ones in Macomb, myself, whatever. You can't overdo your veterinary experience and you can't overdo your animal experience. I would advocate to get as good of grades as humanly possible. Everybody understands that undergraduate courses can be really challenging, but that is your time to shine. If you are considering applying to a vet school or a professional program, definitely prioritize your grades. Resume building, I know that's kind of a term that some people agree with and don't agree with, but it does matter. Networking, meet as many veterinarians or veterinary technicians as you can. Build relationships with them, because eventually you will need recommendations and letters to get into school, to get into programs, to get jobs, to get internships, whatever. And then if you have a vet school in mind that you're super serious about, reach out to them. Every veterinary school on the planet has somebody that works with undergraduate students and sets up tours, Q&As with current vet students. They have veterinary students who are like liaisons basically, and they work with undergraduate schools to communicate with you guys and answer questions that you might have. And I think they give like Zoom lectures and stuff, while they'll meet with like a club and get you guys experience and answer questions that way. This is myself and one of my students through the ag department that I went in the classes that I'll touch base on here in a second. But this is Emma Lowe. I don't, if you guys know her, she's through the ag department, but I have been working with Emma for 3 years now. She reached out to me when she was a freshman here at Western and said, hey, I want to go to vet school. I'm super serious about this. I need experience. I need hours. I want to diversify my resume. And so she's been hanging out with me, and I've done everything with her from small animal surgery and exams to teaching her how to palpate cattle for pregnancy. So we're definitely open to it, and it's definitely possible, and it's absolutely possible here on campus. So as far as our pre-vet program that we're kind of fostering along here at WIU, there's Emma again hanging over my shoulder. So the animal science department, like I said, Dr. Baker reached out to me and asked me to mentor students. And I said, sure, anytime. That was kind of peak COVID, so we weren't really on campus. And then when we kind of migrated back to campus, there was an opportunity to teach an intro level class just to kind of expose some kids to vet med. And I think I had like 18 students, and that went really well. So we bumped it up to a second class. So the ANSI, or the top one here, the 280, is the intro level class. That's the one I started with. That has been through a curriculum review and has been approved as a course that will persist in the ag department. So that is a class that has been approved. It will live in the ag department forever as long as somebody is willing to teach it. So that is kind of where I get my, I guess, my newbies. That I have students from farm backgrounds, from inner city Chicago, from out of state, whatever, with very different backgrounds, but we come together in one classroom and we talk about vet med. We talk about how to apply, specifically talk a lot about classes to take at Western and experiences to get at Western. Since I went here, we spend a lot of time covering what it's like to be a veterinarian, what to expect in veterinary school, kind of some basics, like we do some small animal medicine lectures and cases, and I have some dogs that I bring to class a couple times and the students will mess around with and do physical exams. One of my friends outside of town is really great. She opens up her equine barn to us, and we go out there and do exams on horses and give vaccines and dewormer, pull blood, things like that. So it's a lot of variety. Vet med is a variety as a profession, so I try to expose them to a lot of different areas. If there's an area that a student's interested in that I myself am not familiar with or comfortable with, I send them in the direction of a classmate or a colleague that is comfortable with that topic. So I've taught that ANSI 283 times now, and it's gone really well every time. So the 475 class is the part 2, which is more of like hands-on clinical skills. I wanted to have an opportunity to really get students out of the classroom, because that's where I did my best learning as an undergrad student and a vet student. So we spend a lot of time not in the classroom, and that syllabus schedule kind of fluctuates a lot based on what becomes available through my clients. So in this situation, in this picture here, I had a client who, she had a cow that was not doing well and needed to be put down, and she offered for that to happen in class. And that was a great learning experience for the students. So we actually humanely euthanized this animal in class and then did what's called a necropsy, which is just an animal autopsy, and dissected that animal down to every organ, every vessel, every bone, and the students loved it. I mean, they were super hands-on, super invested in it. It was the first time a lot of them had seen a kidney or a spleen. So that was a great experience for them. The ag department orders like little suture pads, and I teach the students in the part 2 class how to suture and do a lot of basic suture patterns. We do some more hands-on things with my own personal horses. I'll sedate them and let students do things like place catheters and things like that. So I just want kids to have an opportunity to, in the 280 class, ask questions, get them answered, pick my brain about applying, pick my brain about going to vet school and being a vet. And then we kind of touch base on vet school and what to expect as far as being a veterinarian. And then the part 2 class is very much about throwing them into it, getting them the hands-on, teaching them how to suture, letting them do all the things that come available. We also do a lot of preg checking and like ultrasounding. So I have a lot of clients that are very gracious and allow us to come out and preg check sheep and goats with an ultrasound. And then we do some cattle work here on campus with the campus herd. And the kids really like that too. So it's not a lot of time in the classroom with the second class, but I think that's kind of where a lot of the learning happens. So that class, or both of those classes, are through the ag department, or I guess the animal science department in Knob. And then we also have a pre-veterinary sciences club. So if you are interested, but you don't have time to take the classes right now, that's totally fair. There is a pre-vet club that they developed last fall, I think. So it's about a year old. But it's on Instagram, Facebook, the WIU ag page has a link to it, I think. But they love having new people join. We do a lot of hands-on things for meetings, a lot of Zooming with, I think last year we Zoomed with a couple admissions departments at various vet schools, answered a lot of questions. And then I try to get a lot of hands-on labs together for the kids. So those, we meet twice a month. If that's something you guys are interested in, we can definitely direct you in that direction. So, and then that is it. Here's some pictures of my life as a veterinarian. One of the first patients I ever hospitalized in my career, in the bottom right here, is a reindeer. After I graduated vet school, I went out to Colorado and did an internship at a mixed animal practice for the summer, and we ended up hospitalizing reindeer, so that was pretty cool. And I've had raccoons as patients, I've had zebras as patients when I was in vet school, and then everybody loves a cute puppy picture. And I love surgery. Surgery is like one of my favorite things to do, so I get into a lot of interesting situations when it comes to surgery. So I have a lot of pictures and cases I could share if that's something that you guys are interested in. So yeah, I would say vet med as a profession, being a veterinarian, being a veterinary technician. If you don't want to go all the way and be a vet, that's totally fine. We need veterinary technicians who are passionate about it as well. But no day is the same, no patient is the same, no case is the same. It's chaos, but it's a blast. So if it's something you guys are interested in, I would love to talk to you more about it. I am very passionate about vet med. I love being a veterinarian, and I love sharing it with students and getting people about it. So is there any questions from anybody? Yes.
How is the interview into getting into a veterinary school?
Okay, so her question for those of you on Zoom is, what is the interview process like? So I can only speak to when I interviewed. COVID really changed the dynamic of how vet schools interview, but I interviewed with one school over Zoom because it was too far to travel. And it was a lot of questions like, you know, what are your professional goals? What are some reasons that you want to be a veterinarian? Like, what is the driving force behind you applying? What do you hope to get out of veterinary school? Things like that, but also some off-topic questions of like, how would you handle this situation? And how would you handle this type of situation? Very like interpersonal, kind of assessing how you respond to stressful things, or how you would handle stressful, inappropriate situations at work. They kind of want to know that you're passionate about it, and that you're not going to go to vet school and get a year into it and then quit and give up that seat that could have gone to somebody else. But they also want to be able to kind of interpret your maturity level and like your ability to handle stressful situations and also like challenging situations, because vet med is obviously about the animals, right? But a human brings those animals in the door or into your practice, and sometimes humans are the most difficult part of being a veterinarian. A lot of clients are quick to get upset because they're emotionally attached to that animal, and so when things are going wrong, sometimes they overreact and it gets very emotional and dramatic, and so they ask questions specific to scenarios like that just to see how you would handle things like that. The interviewing process, so interviews are usually something that are offered, so you apply to vet school, they sift through all the applications. If you are chosen for an interview, they reach out to you, whether that happens in person or over Zoom is school and person dependent. They used to require you to take the GRE, and then sometimes they would go over parts of your application through the interview process, but now that they've eliminated the GRE and moved away from things like that, I think it's a lot more like situational and personal. Sometimes they touch on things from your application, your transcript. They usually give you an opportunity to talk about things like if you have a semester on your transcript where your grades just weren't that great, but something was going on in your personal life that you were dealing with, they kind of give you an opportunity to discuss that and talk about why maybe you struggled that semester, but how you bounced back from it. So every school is different. A lot of schools offer mock interviews. If you are an undergraduate student who's interested and you reach out to the admissions or the student relations department, they can set you up with vet students who will usually offer mock interviews to give you kind of a taste of what's to come. So to answer your question, it was kind of all over the board. Anything else? Yeah.
When did you find this like the hardest part to get into vet school?
The hardest part, I think honestly, the hardest part for me was like psyching myself out. Like when I was an undergrad student, I was so stressed out, like just overtly stressed out about my grades. Was I getting enough experience? Was I getting all the right clubs on my resume? Like, was I presenting myself as the whole package? The application and interviewing and like submitting all of that really wasn't that hard. It was just the 4 years leading up to it. I was just like a ball of stress. I look back on that now and recognize that I was overtly stressed and didn't need to be. And I tell my students all the time, I'm like, I know you are stressed and you are wigged out beyond understanding and you think that you're never going to get there, but you will get there. If you can go to class and study and establish your study habits and your routine and get good grades and just give it your best effort. I mean, that's all they're looking for. They're not looking for somebody to have a 4.0 with 1 million hours of experience, because that person might be a robot, but are they passionate about vet med? It's kind of hard to say. The hardest part for me was honestly just like being an undergrad student and like taking college for what it was and relaxing a little bit and enjoying it instead of being so high strung and wound up about it. So if I had one thing to say back, don't skip out on being a 20-year-old college kid just to get into a professional program, because once you get into that professional program, you just have to stay afloat. So I don't want to say I gave up being a college kid, but I was like so fixated on working. There was a lot of semesters that I rearranged my academic schedule so that I could work like 40 to 50 hours a week at the vet clinic. I thought for some reason that I needed those hours to get into vet school when really they were more concerned about my grades. So I probably should have shifted my priorities, but that was probably the hardest part for me, was just finding the balance and like allowing myself to just be a human about it. So, but that's also like me personally and my personality. Not everybody's like that. I had some vet school friends that were just like, whatever, you know, they were like, I did undergrad, I did the best I could, I got some experience and I applied, and if it happened, it happened. I wasn't like that. I'm pretty sure that I said I wanted to be a veterinarian at like 8 years old, and that was it, and I was just possessed by it. And so maybe that was just a different course for me. but I would say you don't have to be that stressed out.
Looks like there's a couple of questions in the chat.
Yes.
And if you are, please mute if you're not talking. We keep hearing coughing and stuff. Here's a couple questions.
Okay.
Let me see if we can. Again, thank you.
How many hours of hands-on animal care experience would you say is required? So, some schools have parameters that they like recommend or require you have. That's kind of a gray area because I had classmates in vet school who never worked in a vet clinic. They were very research oriented. They spent a lot of time working for government programs. They didn't have a lot of like hands-on animal care experience, but they were very interested in government and regulatory medicine, like public health medicine. I actually had a classmate who came from the military, went to veterinary school, and then went back to a military base to work with military animals. As much as humanly possible is what I would say. Some schools have bare minimum requirements for you to apply. Every school is different, so I would look those up based on what schools you're interested in. I'm not going to share how many hours I had because I did that to my students one time and they all panicked because some of them didn't have remotely near that, but it doesn't matter because I worked in a clinic from the time I was 15 until 25 or 26 whenever I went to vet school, and that's not how it is for everybody. And like I just said, I rearranged my academic schedule to get veterinary hours. So I don't think there's any set number that you need to get. As much as you can, just make sure it's good quality experience. But also, having said that, if you have animals at home that you take care of, there's definitely an area on the veterinary application for kids that have animals at home, that are raised on farms, that volunteer in pet shelters, things like that, to put hours that are not veterinary specific. So any animal handling experience is valuable. And then, is it hard to not let emotions get in the way, like feeling like you're hurting the animals? Yes. Admittedly, my first semester of vet school, when we started with anatomy and we're dissecting cats and dogs that had been donated to the school after they had been humanely euthanized for various reasons, that was a very strange feeling to get over, because obviously you are interested in vet school or go to vet school because you love animals and you're passionate about them, but then there's this weird thing that you have to get over where dissecting them to better understand them and learn everything is kind of a weird emotional roller coaster. So in the last couple of years, I've started picking up shifts over at the Peoria Animal Emergency Clinic, and that has been also an emotional roller coaster. A lot of times those animals are in horrible situations and you feel like what you are doing is not helping, but then in 24 hours when they have done a 180 or they look better, or if humane euthanasia is the best option for that animal, at least we are able to provide that for them. So yes, it is very hard to not let emotions get in the way. It gets better with time. It gets better with understanding how medicine and surgery works and how it benefits that patient. It also gets better with experience, but there are still days where I drive home and I'm just like having a hard time processing the things that I saw or did. And that doesn't change. I mean, there's a lot of veterinarians that are 30, 40 years into their career and they still have bad days where their emotions get the best of them, because at the end of the day, we're all just huge animal lovers. And so sometimes that's the hardest part. And then, do you know how soon I can get into any of those pre-vet classes or clubs? So classes would be next fall. Right now I'm just teaching both classes in the fall and we're not teaching in the spring. We kind of have a better student enrollment if we teach in the fall than the spring, so that's what we're sticking with. The club meets on Thursday nights at 7 p.m. on the second floor of Nobla. I can't remember what room, but they're actually having a meeting this Thursday. If that's something that you are interested in, you can definitely reach out to me and I can get you connected with that, or look up WIU Pre-Vet Club on Instagram or Facebook and you will find it. But typically speaking, every other Thursday they meet usually in Nobla on the second floor, but sometimes we go out to the livestock center or go elsewhere if we're gonna do some sort of hands-on wet lab, so. Any other questions? Yeah.
What would you say was one of the most memorable cases that you've had?
Ooh, most memorable cases. In a good way or like a traumatizing
Like
way?
in a good way, like.
In a good way. I'll tell the story of Trace because everybody loves this story. So Trace, I should have included a picture of her. Trace is a three-legged sheep, who now lives with one of my best friends, and she came in as a little tiny lamb, like the size that you can carry around. And she had broken her leg. She was born in a pile of mud in the middle of a storm, and it was just not a great scenario to set her up for life. And when her owner found her, he raises sheep outside of Roseville, and so he has a flock, and so there's a lot of them, and so he does like 1 to 2 times a day checks. He found Trace stuck in the mud, brought her in, her leg was dangling, it was her back left. X-rayed her, and she had a fracture in her lower limb. Casted it, said, hey, can she hang out in your garage, in your house, whatever. He's got some grandkids. They set her up in a dog kennel. She was living her best life. Healing her fractures was going really well. She came back in for a recheck. We took the cast off, re-x-rayed, made sure everything was aligned right, recasted, sent her home. She got out, I think, during a storm. I can't remember if it was her. I can't remember the specifics, but she got out and got mangled again somehow. And since she had this cast on her lower limb, she got it stuck in the mud, and above it, she broke her femur. And so he brought her back, and he was like, I think the best case for this lamb is humane euthanasia. My farm is not a situation where she's going to be able to be casted and survive, because a weird thing about sheep is if you are a sheep and you have something abnormal about you, they will pick on you. So she had this neon pink cast. And so the other sheep were kind of picking on her, and I wonder if maybe that's why she got in the situation she did. So he wanted to just humanely euthanize her because she had refractured her leg. And I was like, what if you just maybe gave her to me and I took her leg off? Because at that time in my career, I had never sedated a sheep. I had never ran general anesthesia on a sheep, and I wanted surgery practice. And this is kind of where those emotional things get a little weird, but I was like, if for some reason she doesn't survive surgery or this doesn't go well, it's just a sheep, right? It's not somebody's pet that they're super attached to. So this picture up here in the top left, this is Emily. She is a veterinarian that graduated a couple of years ahead of me from Iowa State. Her and I are very good life and veterinary friends, but we took on that case together. And so we learned a lot from it, from the standpoint of general anesthesia for a sheep is very different than cats and dogs. We intubated her, put her under brain surgery, removed her leg, amputated it up at the hip since she was fractured in multiple places. And lo and behold, she lived, and not only did she live, she thrived. And so then I had to find her a home, and I was like, what am I gonna do with a 3-legged sheep? Because reproductively speaking, she's not strong enough, like doesn't have 4 legs, so she can't carry babies. And I don't want to say that sheep are useless, but most people don't have them unless they're raising them for production. So I talked one of my friends into taking her. And so now Trace lives her best life and is super duper spoiled and lives out on the farm and hangs out with the horses and the dogs and is insanely spoiled. And I get to see her all the time. And so she is a pleasant reminder of like how cool vet med can be and how you can build these really good relationships with clients and save animals' lives and learn all in the same day. I should have put a picture in here. She's pretty cool. She hops around a lot now. She's kind of funny looking because she kept her tail, but she is like the most, we drag her everywhere. We take her to petting zoos. We take her to like 4-H, what is it, farm safety day that they have for the 4th graders, things like that. So not only did Trace live to see another day and have a successful surgery, but now she is beyond spoiled. So that was a good one. So Anything else?
What's been the like worst cases we had?
Ugh, worst cases, I don't know that I could specifically speak to one single worst case. But I do see a lot of things at the ER that just kind of rock your world in the sense of like, how does this happen? Or you don't understand why people have pets and then allow them to end up in the situations that they do. Peoria, I see a lot of clients who will do anything for their pet, and I have a lot of clients who haven't seen their pet in a week and they just throw some food and water out the back door and maybe the pet's alive and maybe they're not. I enjoy working ER because I get to do a lot of really cool surgeries, a lot of intensive medicine, and I learn every time I work a shift over there, but it's very like emotionally taxing and draining. Because I have to understand at the end of the day, not everyone loves animals as much as I do. And so sometimes I see some puppies in situations that I'm just like, I don't understand how this happens. It's kind of heartbreaking, but you do what you can with what you have. I don't know how to answer that as like worst cases, because I couldn't really elaborate on that without making a client sound like absolutely horrible. And I don't want to, because sometimes a lack of finances, a lack of education, a lack of awareness, things like that is all that it is, that these pets end up in these situations. I do see a lot of trauma at the ER, a lot of like hit by cars. Had a dog like impale himself on a baling sphere. So like those spheres that stick out of the end of a loader tractor that they move the big round bales around with, jumped out of the truck and got stuck on a baling sphere and it like went through the dog. That was not great, but that dog lived. When I was in Colorado, I saw a horse that fell on a trailer and got stepped on by another horse in the trailer and it ruptured the diaphragm. So everything that was in the abdomen ended up in the chest. That was pretty traumatic and not great.
What about lame dog or horse legs? You know, the classical move is you always shoot the horse that has broken legs. Do you have to still do that kind of stuff?
Not always. So like veterinary medicine, specifically speaking on equine surgery, has come a really, really long ways. The problem with limb injuries in horses, like the lower you go in the leg, the harder it is to get them to heal because of blood supply. But the other problem is if horses are not standing, then they're causing a lot of muscle issues, they're causing feet issues and their concurrent leg that is trying to bear that weight. Fractures are really, really hard to heal in horses, but we have come a long ways in that, like at the university when I was in vet school, if there were horses from the racetrack, Iowa is actually oddly like a really hot spot for equine racing. And so there was a racetrack like 30 minutes from the vet school, and horses would break their legs. They're young, they're like puppies, they're just bouncing off the walls, they run too hard, they break their legs. We're able to suspend them now, so they have like slings that hang from the ceiling, and you can suspend them and they can like walk around their stall with assistance if they want to, and allow those legs to heal. But most of the time, even if you heal a fracture in a leg in a horse like that, they don't ever go back to 100%. And so sometimes it's just hard to get them to a point where they're comfortable and managing the arthritis and pain that comes with it. But that is a very common misconception because of Hollywood. But we do a lot better with it now. So what would you say is your favorite animal to work on? I can answer that in two manners. So I love working on dogs because I get to do a lot of really cool surgeries with dogs. In the emergency setting, I've done things like take out spleens, take out liver lobes, take out tumors the size of basketballs, take off legs, do open chest surgery, things like that. But my all-time favorite animal to work on that I just love day in and day out is probably horses. So I also really enjoy working on cattle. They're just not as personable. Like horses are kind of large scale pets. Cattle are a production animal, so I enjoy working on them. And I really enjoy like calving season and when they're having babies and stuff like that, but the human animal bond with horses and dogs and cats is very different than livestock, so. Anything else?
Like, have you ever had an experience where, the client comes in and they're not very good towards their animal and then gets to it where it's kind of like really bad? Do you ever feel you have to step in, or what happens to like those animals that you don't feel comfortable with sending them home?
Yes, so if you can't hear on Zoom, she asked about, basically if I've ever had client interactions where I'm not comfortable sending animals home because of the home environment. I have absolutely called animal control or animal welfare or the police, and asked for home checks, and they usually follow up on that pretty well. Most of the time I do that from a case of like abuse and neglect. Sometimes people honestly just don't know, which is kind of hard to swallow. Like in this day and age with the internet and social media and things like that, you would think that people would be a little bit more aware, but there are still people out there that aren't. And so that's an opportunity to educate them and just kind of fill them in on what they need to be doing or what they could be doing differently. A lot of clinics offer like relinquishment options. So the ER in Peoria, I've actually acquired quite a few animals from there. So I've worked at the ER, for example, for 2 years on a weekend basis, like 1 or 2 shifts a month, and I have had 27 dogs relinquished to me that I take, fix, and rehome or put into a rescue or whatever. And so it does happen where there are situations where that animal should not go home with those people. Absolutely have to just have a very awkward conversation with them. Sometimes they get defensive and reactive, sometimes they have no clue, and so it's an opportunity for you to elaborate on what they can do differently on the benefit of their pet. At the end of the day, most people are in a vet clinic because they care about their animal and they want to take care of them. They just need help and guidance. But having said that, I have absolutely had situations where I have filled out a police report and turned it over to the cops, turned it over to animal control, and they follow up, and whether legal action is taken or not is dependent on how bad it is. So, the dogs that I've had relinquished to me at the ER are usually financial cases or like abuse and neglect cases, and the owners just don't want the dog and they're just looking for an outlet to get rid of that animal. So in that situation, I have them turn them over to me. They sign paperwork that legally they are turning that animal over to me. I do whatever that animal needs to get them healthy and then rehome them, which is very fulfilling, but also very frustrating. So, and in that situation, I have also kept 6 dogs. So I have 6 dogs at home right now, but it's fine. Anything else? Yeah.
What's the difference between being a veterinarian and like a veterinary technician?
So question is being the difference between a vet and a vet tech. So kind of the same thing as like being a human doctor versus a nurse. I would compare veterinary technicians to like RNs. There is an immense amount that they can do. Basically, the only thing that veterinary technicians, legally speaking, cannot do is surgery, make a diagnosis, and write prescriptions. Vet techs are the most underrated, underpaid MVPs of the vet med world. Like, I rely on my vet techs like you wouldn't believe. And sometimes they are 100% better at things than I am. There are definitely situations where if I can't get an IV catheter in a dog, I turf it to one of my technicians because they're better at it. I trust a lot of the technicians that I work with to go ultrasound an abdomen and look at a bladder and obtain a urine sample and run diagnostics, and then they come to me with the report. So a lot of vet school is a lot of educational work, and if you have skilled, confident technicians, you're not doing a lot of things like pulling blood, placing catheters, surgery prep, poking them with things, whatever. The vet techs do that. So they're kind of the behind the scenes running the show. The veterinarian is the one who makes the decisions, the prescription decisions, the surgery decisions, and has a lot of conversations with owners. But vet techs do an insane amount of work. As far as school, yes, you can leave if you need to for another meeting. As far as school, vet tech school, I believe, is 2 years. depending on the program you go to, and the prerequisites that you would have to do in undergrad is not as extensive. So my friends that went to vet tech school, some of them just got an associate's degree and then went on to vet tech school. Some of them got bachelor's degrees and then went to vet tech school. Doesn't really matter. But tech school is shorter and probably cheaper than vet school. So it's just a difference of basically being the nurse versus the doctor. So, yeah.
So like if a hoof gets infected, like, or like if something happens to it, do you work on that or do like farriers work on that?
With horses,
Yeah.
usually it's a collaborative effort between your farrier and your vet. So your vet is the one who is taking the x-rays and making the medical recommendations, but a lot of times the farrier is the one throwing the shoe on or doing the different changes to the hoof. There's a lot of crossover there. Sometimes veterinarians take an interest in equine podiatry and learn farrier trades. And some farriers take an interest in equine medicine in regards to the foot. And so they'll work really close with the veterinarian on a lot of those situations. But yeah, a lot of those are crossovers. It takes both professions to keep the foot healthy in a horse. So. Yep. Good questions. I like conversation, so I'm glad you guys had questions. Anything
Anyone else
else?
have a burning question before we wrap up the class?
Yeah.
So you said you teach classes here at the school and you're practicing that.
Yeah.
What's the balance? between that?
Chaos. I don't know how to answer that well because I haven't gotten it down well. This is my 5th semester teaching, but it's the first semester having both classes at the same time. I used to have the classes late in the afternoon, so I would like go to work, practice all day, and then come teach. But with having both classes in this fall semester, I allocated Monday, Tuesday, Wednesday to the classes, and then Thursday, Friday, and sometimes a Saturday or Sunday I work. But I also am notorious for working before or after class when it comes to vet med. I haven't quite figured out balance or quality of life or work-life balance or whatever term you want to use. But right now I'm okay with that. Someday I might get a little more tired and want to slow down, but I'm at a point where I'm young enough and still passionate about vet med that I want to do as much of it as I can. So I kind of make vet med work around class because there's always a need to be a veterinarian. So, but right now I would say 3 days a week I teach and 3 days a week I do vet med, and sometimes I have time off in between there. So chaos is the bottom line. So.
We're pretty, unless we have another burning question, probably gonna. I'd like to thank Dr. Whiteside for coming today.
Yeah, I'm happy to talk about it. And if you guys have questions about the class or the club, don't hesitate to reach out. I can get you in touch with the kids or the e-board as well. So thank you guys for your time.
Thank you, Dr.
Yeah, no problem. And if you want this PowerPoint, I can.
Oh. Okay. Sounds great. Did anybody, a lot of good questions today, actually.
Yeah, that was good.